Welcome to Prosto Decoded. In this video, we are going to learn in detail about dental investment materials. So, before that, we should know where they are used. So, as you can appreciate in this image, this is a decayed tooth, means most of the tooth structure is lost. So, the patient comes to a dentist and we remove the caries and treat the patient with the root canal treatment. So, in that, we remove all the caries and we give a dental crown to the patient so that the tooth is protected from the biting forces as the tooth structure is weakened. Now we need to make a dental crown. For that, we first need to shape the tooth in such a way that the crown does not get removed while biting or chewing during mastication. So this process is called as tooth preparation. After the tooth is prepared, we make a final impression, and this is how the impression is made. The impression is the negative replica of the tooth structure. After that, we pour it with dental stone, and this is how we get a dental cast. Dental cast is the positive replica of the prepared tooth. So, this is our prepared tooth. Now, we'll make a dental crown on this tooth and cement it on the patient's tooth. This is how we protect the root canal treated tooth. Then the process of making a crown is called as the casting procedure, and in this procedure we need our investment materials. So as you can see, in the first step is the wax pattern fabrication. So like in DADH, how we carve the tooth anatomy, similarly we have to carve it on this prepared tooth. After that, we do the investing. Then we place the wax pattern and we fill it over with the investment material. This is the casting ring. We put the wax pattern and pour it with the investment material. Then we place the casting ring in the burnout furnace. So what will happen? The wax will melt and there will be a hollow space or a mold which will be formed. Now in that mold we will put the molten material. This is called casting. And after that, we'll allow it to cool and we'll remove it from the set investment material. So removing from the investment material is called as divesting. After that, we finish and polish and we'll cut the single crown and we'll give it to the patient. So this is the casting procedure in brief. And I told you this just to know that how the or where the investment materials are used. So what is a dental investment material? It is described as a ceramic material that is suitable for forming a mold into which a metal or alloy is cast. So as we have seen, this is the casting ring, this is the investment material, and this is the mold into which we pour the metal or the alloy cast. And this is also called as refractory material. Why? Because in the burnout furnace it withstands high degree of temperature, and that's why it is also called as refractory material. Now, what are the ideal requirements of the investment material? First, it should be easily manipulated. Then it should have sufficient strength at the room temperature as well as stability at higher temperature. Because if we are placing it in the burnout furnace, then it should not um, undergo fracture or it should not break. It should protect our casting. That's why we need it to be stable. It should have sufficient expansion. Now this is the most important property of the investment material. So why do we need expansion? So when we put a cast alloy or molten metal in the mold, it has tendency to shrink. And if we allow it to shrink, then we'll get a smaller casting and it will not fit on our tooth. So to counteract or to balance this effect, we need the investment material to cause sufficient expansion so that this shrinkage is compensated. Then we need it to be porous, so it should have porosity, it should not be compacted. Now why it should be porous? Because it should allow the gases to escape. It should allow the gases to escape. If the gases are entrapped within the investment material, then it will cause casting defects. And it should have smoother surface so that we get smoother castings. Then it should have ease of divestment, means the removal of the crown from the investment material should be easy and it should be economical. So these are the ideal requirements of the investment material. Now we'll see the composition. So any investment material, like any type of investment material, has three basic components. First is the refractory material. Now as I have told you, refractory means it withstands temperature, so there is some component which is acts as a refractory material. Then there is a binder. Binder means then there is a binder. Binder means it will bind the refractory material together. And then there are modifiers. Modifiers, they will modify the setting time, setting expansion. So any investment material has three major components. First, refractory material, second is the binder, and third is modifiers. So based on this binder, there are three types of investment material. First is the gypsum bonded, second is the phosphate bonded, and third is the ethyl silicate bonded. So in the gypsum bonded, gypsum is the binder. In phosphate bonded investment, phosphate is the binder, and in ethyl silicate bonded investment, ethyl silicate is the binder. And it has different purposes. So gypsum bonded investment material is used for low fusing alloys or conventional gold alloys. Gypsum bonded is used for gold alloys. Phosphate bonded investments are used for high fusing alloys like metal ceramic alloys, cobalt chromium alloys, nickel chromium alloys, and silica bonded investments are used for base metal partial dentures. So these are rarely used, but we should know the use of the silica bonded investment. So it is used for base metal alloy partial dentures, as you can see in this image. Now we'll see in detail about gypsum bonded investments. So the composition of gypsum bonded investment. So as I told you, first is the refractory material. So refractory material is silica. In all the three types, refractory material is same, which is the silica. Only the binder will change. So silica has two allotropic forms. First is quartz and second is cristobalite. Quartz and cristobalite, and it accounts for the major portion of the investment material, around 60 to 65%. Then alpha hemihydrate, which is dental stone, it is around 30 to 35%. And then we have 5% of modifiers. Now the maximum safe temperature for a gypsum bonded investment is 700 degrees centigrade. So it can withstand only up to 700 degrees centigrade of temperature, and that's why it is used for gold castings. So what are the function of these constituents? So alpha hemihydrate is the binder, so it will bind the silica particles together and it will provide sufficient strength. Now silica is the refractory during heating. It withstands the temperature and it regulates the thermal expansion. Also it increases the setting expansion. So which was the most important ideal requirement of the investment material? It was the setting expansion. So the refractory material, that is the silica, it helps in setting expansion. And also during heating, gypsum has a tendency to contract, so silica will eliminate its contraction. These are the most important functions of silica. Now modifiers are reducing agents and some modifying chemicals. So reducing agents are like carbon and copper powder. This will provide a non-oxidizing environment to the casting and prevent its contamination. Now modifying chemicals are boric acid and sodium chloride. They will regulate the setting time, setting expansion of the casting. Now the setting reaction is same as that of the gypsum. Hemihydrate when mixed with water will give dihydrate. The setting time is around 9 to 18 minutes. And there are various factors affecting the setting time, which we will see in detail in the later slides. Now we'll understand the thermal behavior. So as I told you, gypsum shrinks at higher temperature and it releases sulfur compounds. What it releases? Sulfur compounds above 700 degrees centigrade, which can contaminate our castings. So there will be casting defects. In order to avoid that, we should not heat the gypsum bonded investment beyond 700 degrees centigrade. And the thermal behavior of silica. Silica at room temperature is in the form of alpha quartz and it converts to beta quartz when heated. So this temperature is called as transition temperature. The transition temperature for quartz is 375 degrees centigrade, and for cristobalite it is 200 to 270 degrees centigrade. So as you can appreciate in this image, this is alpha quartz, and it will change at a transition temperature when we heat it to beta quartz. So as you can see, the rings of alpha quartz are compacted, and when they are heated they expand. So alpha to beta conversion increases volume and increases linear expansion, which is required for an investment material. Now we will understand how expansion takes place. So these are the nuclei from which the crystals grow. So suppose these are the powder particles, and when we mix it with water, these nuclei will exert outward thrust. So these will exert outward thrust, and these outward thrusts make the spherules contact each other, and it will cause expansion. So outward thrust causes the expansion. Now there are three types of expansion. First is the normal setting expansion, second is the hygroscopic setting expansion, and the third is the thermal expansion. So normal setting expansion, as the name suggests, it is caused due to the crystal growth. As I told you, due to outward thrust, normal setting expansion takes place. It is around zero point 0.4 to 0.5%. Now, what is hygroscopic setting expansion? So, as the name suggests, it occurs when setting in contact with water. So during immersion in water, so we allow it to cool and it comes in contact with water. This should take place before the initial setting of the investment. So water facilitates the outward crystal growth, and this is greater than normal setting expansion. It is around 1.2 to 2.2%. And what is thermal expansion? It is obtained by heating a mold in furnace below 700, because above 700 it will cause release of sulfur compounds, and it will come, and the thermal expansion compensates for the casting shrinkage. This is an important point. So these are the three different types of different types of expansion. Now in this image, as you can see, these are the normal setting condition and this is hygroscopic setting condition. So as you can see, this is a normal setting condition, and when we keep it in contact with water, there is increase in the surface area or increase in the expansion, and the nuclei can grow much more than the setting expansion due to the outward thrust. As you can see in this graph, this is the hygroscopic expansion, which is far more compared to the normal setting expansion. Now we'll see about factors which affect the hygroscopic expansion, and this is an important question. So first is the composition. Finer silica particles will produce greater expansion because they will apply more outward thrust. Now, alpha hemihydrate produces more expansion than beta hemihydrate. That is, dental stone produces more expansion than dental plaster. And higher silica content will give higher expansion. Now, water powder ratio, this is an important concept. Higher the water powder ratio, lower will be the expansion, because the water content will go increase and powder will decrease, so the nuclei will decrease, therefore the outward thrust will decrease, and therefore there will be lower hygroscopic setting expansion. Now higher temperature will cause higher expansion. If we immerse before initial set, then higher expansion. If shorter mixing time, then lower expansion. If the investment is old, then there will be lower expansion. If we give greater confinement, then there is reduced expansion. Confinement means this is the casting ring in which we have placed our um, wax pattern, and this is the investment material. So due to higher confinement, due to the casting ring, there will be lower expansion. Now, what are the factors affecting thermal expansion? So, thermal is most related to the refractory material, that is silica. So, more the silica, more will be the thermal expansion. Cristobalite will have more expansion than quartz. In water powder ratio, more the water, less will be the expansion. And then the chemical modifiers like sodium chloride, potassium chloride, lithium chloride, they will increase the thermal expansion. and prevent the gypsum contraction. Then alpha hemihydride, which is the binder, it increases the strength. Chemical modifiers also increases the strength. Water decreases the strength. And we should store the investment material in an airtight container. The porosity, as we know, is required to allow the escape of the gases during heating. And a mixture of coarse and fine particles shows less porosity than the uniform particle size. And we also know that the fine particles are preferred over the coarse particles because the fine particles will give us the smooth castings. So this was in detail about gypsum bonded investments. Now we'll study about the phosphate bonded investment. So phosphate bonded investments are mostly used nowadays. They come in powder and liquid format. So powder, the composition of powder is silica, which is up to 80%. Then we have magnesium oxide, ammonium diacid phosphate. So ammonium diacid phosphate is the binder of the phosphate bonded investment. And then there can be carbon. There are also, if the carbon is absent, then there is carbon free investment. And the special liquid is colloidal silica solution. So this is a colloidal silica solution which is required to make the phosphate bonded investment. Then what are the uses of phosphate bonded investment? So as I told you, they are used for high fusing noble alloys, metal ceramic alloys, nickel chromium and cobalt chromium alloys. So we need temperature more than 700 degrees centigrade. This, the advantages of phosphate bonded investment, it withstands temperature of up to 1100 degrees centigrade, and therefore it has high strength and high thermal expansion. That's why phosphate bonded investments are used. So this is the setting reaction. It forms silicophosphate at the higher temperature, and this gives it the higher strength and higher thermal expansion after setting, and also at the room temperature. Then the third type is silica bonded investments. So there are two types of binders, ethyl silicate and sodium silicate. So there are two types of systems accordingly. There is ethyl silicate system and aqueous silica systems. And the use is high temperature casting procedures, like we use it in making partial dentures, base metal alloy partial dentures. Then there are some special investment for some special purposes. So first is brazing or soldering investment. So what is soldering? It means to join two metal parts together. So they are used for joining FPD segments. So if we have to join two crowns or one pontic and retainer, or attaching clasp to the RPDs. So now this is the major connector and this is the clasp. So to join this, we use soldering investment. For fixing precision attachments, soldering investment is used. It is also of two types, gypsum bonded and phosphate bonded investments. So, what are the ideal properties of the soldering investment? We require lower setting expansion and lower thermal expansion. Why? Because if the expansion is more, then there are chances that the assembled particles may cause some movement, and there will be no accuracy of the joint parts. So, we need to prevent movement of the assembled part, and that's why we need lower setting expansion and lower thermal expansion. And now for titanium casting, we need different investment. Why? Because there is a problem with titanium. Titanium reacts with silica at higher temperature. So the solution is we use magnesia, alumina, or zirconia based investments. So, for special purposes like soldering, we have soldering investment. For titanium, we have titanium investment. And apart from this, we have three investment: gypsum bonded, phosphate bonded, and silica bonded, out of which phosphate bonded investments is used. So, in summary, what we have learned, investment material is the ceramic material used to form a mold into which the molten alloy is cast. It is also called as refractory material. It has three components: refractory, binder, and modifier. Refractory can be quartz or cristobalite. It is around 60 to 65%. Then binder is gypsum bonded, phosphate bonded, or silicate bonded. Then there are modifiers like sodium chloride, boric acid, potassium sulfate, copper powder. Then the classification. The main classification is based on the binder. So it can be gypsum bonded, phosphate bonded, or silica bonded. Gypsum bonded, the most common use is for gold alloy. The composition is silica, alpha hemihydrate, which is the binder, and modifiers. The maximum safe temperature was 700 degrees centigrade. Now, the phosphate bonded. Phosphate bonded, the uses were high fusing noble alloys, metal ceramic alloys, nickel chromium, and cobalt chromium alloys. And the advantages were it withstands temperature of up to 1100 degrees centigrade. It has high strength and high thermal expansion. Composition, silica remains the refractory material. Then we have magnesium oxide and ammonium diacid phosphate, which was the binder. And then carbon is optional. In liquid, we have colloidal silica solution. And silica bonded investment were either ethyl silicate bonded or sodium silicate bonded. Then there were three different types of expansion. First, normal setting expansion due to outward thrust of the crystals. Then we have hygroscopic expansion, which was more than the normal setting expansion, up to 1.2 to 2.2%. It occurs when it comes in contact, when the investment comes in contact with water. Then thermal expansion was produced during heating, and it compensates for the casting shrinkage. And we have we have investment materials for special purposes like soldering. We have soldering investments. For titanium, we have magnesia, alumina, or zirconia based investments. Then we have some specialized investments for ceramic restoration or heat press ceramics. This was the summary of the investment materials. Hope you understood all the points. Thank you.